Great. So hello, good morning. Kumusta?
Good
Magandang
morning, Ben.
umaga. Yes, so we're here. As you've just said, I'm Ben de Guzman, the Director for the Mayor's Office on Asian and Pacific Islander Affairs. And we're really glad to have you with us today to talk about the 50-year history of the Filipino Nurses Association of Metro DC. So let's start by having you tell us your name and your title in the organization.
Well, thank you for this opportunity, Ben. We really appreciate it. My name is Carol Robles, and I am the current president of the Filipino Nurses Association of Metropolitan DC. I am also the communications and marketing chair of the Filipino Nurses Association of America, our national organization.
Oh, great. So you have roles both in the chapter here as well as the organization nationally.
Yes, that's correct.
That's great. So, well, congratulations on your 50th anniversary.
Thank you so much.
I know that there is official history in the archives somewhere, but can you share with us a little bit about the history, the past 50 years, and the mission, and talk to us a little bit about the organization and its 50-year history.
Okay, so the Filipino Nurses Association of Metropolitan DC was founded in 1971, and as you said, we just celebrated our 50th anniversary last November 20th, and it stemmed from the need of the new nurses to pass the state board examination. There were around 10 nurses who founded the organization way back in 1971, and throughout the years, the chapter or the organization found its way to giving back to the community through community service, education, and many other things.
Because at that time in the 70s, just as a sociological reality, the nursing industry here needed more folks, right? And
Correct.
Filipina nurses, had English language skills, had the expertise, and became very high in demand. Is that right?
That is correct.
Yeah.
Yes. So the founders really felt that one way of giving back is to hold these review courses. They did hire reviewers to provide this to their members, and they've been very successful with that.
Right. So beginning in the 70s, you began to see a lot of nurses come from the Philippines here, to the point where, as the numbers as we understand it are, Filipinos are about 1% of the U.S. population, but are about 4%, four times that amount in the nursing industry. So, the narrative of the Filipino nurse is well entrenched in our communities. The joke is everyone in the Filipino community has a family member or someone who is a nurse, right? Myself included. So in the interest of full transparency, my aunt, Diana Camiso, has been part of the chapter here and has been part of the leadership. But what would you say about the role that nurses play in the Filipino community?
Yeah. Just to mention a little bit about your aunt, Diana Comiso. Actually, when I came here in the United States in 1991, Ate Diana was one of the nurses who picked us up from the airport.
Ate meaning big sister.
Yeah,
kind of.
Ate meaning older
Yes.
sister. Yeah, yeah. Miss Comiso, together with a few other nurses, picked us up from the National Reagan Airport and took us to the facility who hired us from the Philippines. The nurses that were brought in by just that one facility amounted to almost 50 plus throughout the years, and that facility is in Washington D.C. It's in Southeast Washington D.C. and we have had a lot of nurses who became very successful, started from that facility. I want to say that the nurses are really highly respected. Filipino nurses, especially, it's synonymous to being trusted, being hard worker, and they're very sought after by a lot of employers and the community.
Mm-hmm. Yeah, so we talk about so whether it's all of the healthcare healthcare providers in the district, in the area. My aunt worked at Georgetown for a number of years and did her nursing graduate work there. But I think it touches on this idea of Filipinos have of public service, right? So whether it's working for city government or folks in the military, we have a long history in the Navy, and our Filipino World War II veterans, obviously, that we have a lot of respect for. And to me, I see the nursing industry and our Filipinos there as part of that kind of legacy of public service. What would you say about that, particularly as we begin to think about COVID-19?
I believe that's in our soul as Filipinos, to be of public service. We go above and beyond what is tasked, of us. And, I want to think that, there should be more in the higher level positions than what we have right now. But it is very important that I believe, step up and, take a major role in, wherever, whether it's healthcare or public service. I know we have a lot already there, but I think we can step up, a bit more.
Yeah, I would say that a lot of the role that PNA plays to support nurses who are in the area, right? I think as that backbone that provide you all with the support that you need to better do your jobs, to better engage the community. I feel like, organizations like PNA help make possible, the directors of nursing who are Filipina, the Filipino nurses who are making their way up the leadership chains of command, in our hospitals. But I think that, unfortunately, the flip side of some of the numbers that we've seen is that Filipinos have also been, disproportionately affected by COVID-19. So you've seen some of the numbers of nurses who have lost their lives. Many of them have been Filipino. So how would you describe the role that you've seen our Filipino nurses play during the pandemic?
Yes, so you're right. With a lot of the publications, it did mention about the Filipino nurses being 4% of the of the registered nurses in the country, and yet around 25% of the mortality for the COVID-19. I think it's because a lot of our Filipino nurses are in the frontline areas, which are like the ICUs, the intensive care units, and we tend to gravitate towards more of those areas than being on the administrative side. So I think that's the reason why there's a lot of mortality. Also, we have a lot in the emergency departments, and a lot of us are in the multifamily household. And I think that also contributes to the mortality.
Yeah, how would you describe the role that PNA has played in addressing, some of the challenges we face as a community because of COVID-19?
We're fortunate to have immediate past President Lourdes Carriga during the pandemic last year. She did initiate a lot of programs and projects to address the need. We had masks for the homeless, and with that, we distributed disposable and cloth masks to around 50 homeless shelters in the area. And then we followed that with masks for the school children, which also we distributed disposable and cloth masks to 50 public school in the Metro DC area. And we said 50 because it's in honor of our 50th anniversary.
Right.
Yes. So in total, I want to say we distributed around 20,000 cloth masks and around 15,000 combination cloth and disposable masks for the school children. Besides that, we also had the webinars. We did a lot of webinars as sort of like educational tool for our community, and a lot more that I cannot think of right now.
Can you talk about the vaccination clinics
Okay.
that we did together?
Yes.
So I think that's a really important part of the partnership that we've had in addressing COVID-19.
Yes, so we are very fortunate that we get to partner with you, the DC Moapia, for the vaccination clinic. So far, we had 2 vaccination clinics.
And as well as Iglesia Ni Cristo
Yes.
and the Philippine Embassy.
That's right, yes.
And
So-
DC Health, obviously, because
Yes, so we are very honored and thrilled to have partnered with your organization, with the Iglesia Ni Cristo, yes, the Philippine Embassy, and the DC Health. And in total, I believe we provided around over 400 vaccination, and we were thrilled to see DC Mayor Browser on our first vaccination clinic.
yes, she is one of those 400
Yes.
shots in arms that we delivered over those 2 clinics.
Yes, that's right. And the last one was like really very busy. And we vaccinated over 300, I believe, at that at that time. So we, as an organization, are very open to all this collaboration. We also have other organizations like American Diversity Group that we help out to provide vaccination clinics, or at least help out with the vaccination clinics that they have.
Great. So I think that from our perspective, because those clinics were so successful, hopefully it speaks to people seeing the need to get vaccinated, right? And so again, we want to make sure that people get vaccinated. We want to make sure that people get tested. We want to make sure that people keep themselves safe. And so we're grateful for the expertise and the service and the public service that you've provided in helping us get those 400 shots and those 400 arms. But moving forward, what do you see? What do you see in terms of the next 50 years of PNA in the Metro DC chapter?
Well, Ben, let's see. I do see PNA Metro DC be exposed and be known not just locally but nationally and internationally. Also, I foresee that we will be a policy changer in this area, and our members be the health advocate for changing health policies, affecting not just Filipino Americans but also the U.S. population in general. After all, we are in Washington, D.C., which is the capital of the United States.
Yes. Yeah, no, and so, obviously Mayor Bowser cares a lot about healthcare policy, wants to make sure that we're covered in terms of healthcare coverage, that we're taking care of ourselves, and certainly we're looking forward to your partnership in making that happen here, DC, locally, and as you've said, having an ability to have a national impact because we're in the nation's capital. So thank you for that. Is there anything else that you feel like you want to say as we wrap up here and we want to finish telling the story of the Filipino Nurses Association?
Yes, and thank you for this opportunity. Our membership is growing, although we haven't even really scratched, the surface of the Filipino American nurses in the area. So my plea is for the RNs out there, the Filipino RNs out there, to please be involved and be a member of the organization. Together, we can be a loud voice, we can make changes, and we can amplify a lot of advocacies that will benefit the Filipino American nurses.
So you heard it here. Our Filipino nurses, hopefully they'll begin to reach out to you in even larger numbers. As someone who has been taken care of by Filipino nurses at Howard University Hospital when I needed care there, I can attest to the expertise and the care that you bring. And as a partner of your advocacy work, of your public service with these vaccination clinics, I can also attest to your commitment to all of our communities. So I just wanted to close by thank you for coming, by congratulating you again on 50 years of PNA here in DC, and to wish you luck on the next 50 years.
Well, thank you so much, Ben, and we are looking forward to more collaboration in the future and more success for us.
Yes, thank you very much.
Thank you.